So pest control is something that you'll probably run into once or twice throughout the year. And some of those things are really easy, such as the Asian beetles, bees, wasps, things of that nature. There's not a whole heck of a lot we can do for that. However, there's a few things I'm going to give you so you can provide some information instead of telling the student that there's nothing we can do for them. So for bees and wasps, that's something that we have to make sure that we are calling in for the right thing. Pest control costs us a lot of money, and we don't want to have them come to a room just to get a bee, a singular bee. If they had a wasp nest or something like that, that's a different story. And things that we can do to check on that is if a student came to you and said, there's bees or wasps getting in my room, even Asian beetles or some sort of fly getting into my room, we first want to see if we know where they're getting in at, such as the screen in their window, maybe a hole around the perimeter of the window, things like that. If we could do a little bit of investigative things on our end, that provides a lot of information for the pest control folks as well as carpenters to seal up those areas. So that's the information we can provide to them. If it's a bee, a singular wasp, those type of things, we're going to handle those I'm going to ask that the RA handles them yourselves or get staff involved. But to bring pest control out for those, it's an extreme thing. Things like rodents, such as mice, we want to make sure we're getting ahead of those very quickly. So you work with your head staff immediately on things like that, and we'll get pest control up within a couple of days to take a look at it. Bed bugs is another issue that's kind of been on the rise in the last several years, and we have a very good protocol here at Western Illinois for that. The first thing we want to do is actually keep the student calm. It's a very sensitive topic, and students often think it's because they're dirty or because they aren't well kept, that's a hygiene issue, and that's not the truth. The fact of the matter is that bed bugs has become something that's become an epidemic from travel, because we do so much travel. They can move around very easily, and they can live some pretty excruciating circumstances, and so they can outlast a lot of things. And so that's why it's kind of resurged. And our best way to deal with it is to get pest control in here and to deal with it as soon as we can. So we want to keep that student calm. We don't want to broadcast it on the floor. The other floor has nothing to be concerned about. At that point in time. But what we'll do is we'll get pest control in to do an inspection first. An inspection is the key because we have an integrated pest management system here on campus, and we want to make sure that we're treating for what we find. We don't want to use a chemical or do something in terms of a practice that isn't going to control the situation. So we want to make sure we're doing our due diligence on trying to track that pest first. So they will check. They'll come in. They'll do an inspection. They'll check the bed. They'll check crevices. They'll check inside vents. They'll check inside outlet covers. They'll do things of that to see if they can, and also put monitoring or bait stations out to see if we can find the pest. They'll then come back, and if it's confirmed, we will then enact a protocol. And that protocol, your head staff will walk through with you. It's an invasive protocol, which involves a lot of packing and sealing up of items, but it's effective, and that's what we do to maintain it. We don't move the student, and we don't move or replace mattresses for them, because what we found in that is that we just replace the problem. So they may feel better right off the bat, but in 1 or 2 weeks, if it's not treated, they'll have the same problem again. And the last thing we want to do is put a student in another room and also put a mattress that's just going to become infested again. So those are the first couple of things. The process itself takes about a month to get from start to finish, but within the first week, that student usually becomes it's a lot easier for them and a lot less nerve-wracking for that student. And that's probably where you guys are going to come in the most. Is not necessarily it'll be in the forefront of it, but not necessarily in the middle. It's towards that end, or when that student starts to feel better, that's where you guys are going to be helpful, because they're going to start to not want to put their stuff in the bags, they want to unload their stuff, put it back in drawers, rehang things, and that's where we want to keep those things sealed up so we can continue with our treatment process. And that's where we're going to ask you guys to help be supporters and advocates for that program for us. After about after about a month and a few inspections, we will give the all clear, and that student will be able to unpack things, put things back in, and get a little bit back to normal. Another topic that's kind of been at the forefront of news has been infectious disease. And it sounds scary, but what I'm talking about is cases of mumps, MRSA, even meningitis, things of that nature. When we have those cases, we work those through Butte Health Center and members of the health department in the county, and even in the state sometimes. Our infectious disease protocol is pretty simple, and really what it is we take our cues from Butte. If a person has like a staph infection or MRSA or something of that nature, they'll work with us and work with BU to make sure like we quarantine a shower. So we may take a shower offline. We may provide them extra cleaner that they can provide themselves. But we'll never put a student up on a floor with another group of students if that may be cause for concern for those other residents on the floor. We'll work with them and we'll work through it, and we have done it in the past, and it's worked very well. Things such as mumps or cases where they have to be quarantined, we have special areas on campus and a special protocol in place where we'll pick that student up, move them to their quarantine or temporary status, work with them throughout that process, and bring them back at the end of that. Our biggest goal is to make sure that they can continue to go to class or study or get those materials and still have a comfortable living environment. And so we'll take care of that. But if a student comes to you and thinks they may be sick, or if you hear about a disease, infectious disease such as mumps or something going around campus, you want to direct them to BU first. That's the starting point, and that's where we wanted to begin to take our cues from.